This is going to happen to every woman, right? She's going to go through this change of menopause. Vaginal estrogen can come in multiple different forms. It can come in cream form, ring form, which is a ring you place inside that stays in there for 3 months, or a suppository. When you see pink urine, you are concerned about bleeding. And when you have blood in the urine, this is not something you should wait and see. I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast. Today, we're answering your questions on the Ask Me Anything episode of the podcast. If you want to be able to ask me anything, you can join us at renamalik.supercast.com, where you'll be able to ask me anything, as well as access ad-free and early episodes of the podcast. Now, without further ado, let's get to it.
My wife seems to be dry when we have sex. She's only 44, so not like she's old, but I'm noticing she's having pain with sex if I enter and she's not wet enough. And it hurts me too if she's not wet enough. We have a normal sex life outside of this, and she tells me she's turned on and even initiates sex with me, but then when we hit this dryness issue during actual sex, things can become a problem. Are her hormones off or something?
Okay, so why do women get dry, right? And the question often comes up, is it because she's not aroused? Now, that's usually not the case. Vaginal lubrication changes due to a variety of factors. So it can change due to genetics, it can change due to medications you're on, and it can change due to hormones. And so in this case, she's 44, and so she might be perimenopausal. But even women who are younger, if they're on certain medications, like sometimes oral contraceptives or other medications, can change the amount of lubrication you make. And so if you're noticing this and you're younger, talk to your doctor about the medications you're on and see if some of them might be contributing. Now, in terms of someone who's around the area of menopause, now the average age of menopause is 51, and menopause is defined as 1 year without a period, but your hormones start changing up to 10 years before that. Now, usually it's around 7 years, but for some people it can start even 10 years before that. And so what happens during this time is that your estrogen is decreasing, and it's actually at a little bit of a roller coaster. So sometimes it can be low, sometimes it can be high, but ultimately the end result is that estrogen is going down. And what happens when estrogen goes down is estrogen also goes down in the vaginal area, the vulvar area, and it can create changes. And one of these changes is vaginal dryness. And this is because there's not enough estrogen around. So what can you do when this happens? This is going to happen to every woman, right? She's going to go through this change of menopause, but not every woman will have dryness to the same degree, and some it may take much longer and some may come much earlier. And this is again due to different variations in how hormonally sensitive you are as an individual. But it doesn't mean there's something wrong with you or anything like that. It's just a normal thing that's going to happen because of changes in our body. And this is called the genitourinary syndrome of menopause, and 80% of women experience this after menopause at some point. Now, what can you do? So first and foremost, you can use lubricants. I've made a video on my YouTube channel reviewing different types of lubricants: water-based, oil-based, silicone-based. Very briefly, water-based are very readily available, but they do tend to evaporate quickly. So you will need to reapply. So the typical KY jellies or things that you buy over the counter, those will evaporate. So you're going to need to reapply if you're having sex and it's taking a little bit of time, which is typical for most people. So that's important to realize, is that you might put some on and then it dries up and now you're both uncomfortable because it's not lubricated well. The next option is silicone-based lubricants. These do last longer. They are a little bit more slippery, and sort of you have to see if you like how they feel. You typically can use them. Most people can use them and tolerate them pretty well. Again, always spot test anything you're going to put on your genitals elsewhere, like on your arm or hand, before you put it on your genitals to make sure you don't have any sort of allergic reaction. The only thing with these is you want to technically avoid using them with silicone-based sex toys, but otherwise safe to use. Oil-based lubricants also last longer. They're usually based out of coconut oil or olive oil. They also are very nice for a lot of people. They do tend to sometimes stain your sheets because they're oil-based and you don't want to use them with a condom. Next option, if you don't want to use lubricants or that's not cutting it, is using some sort of vaginal moisturizer. Now, these are just like moisturizers for your face. They typically have ingredients like hyaluronic acid in them, and they're placed in the vagina daily or every third day. They can be either creams or suppositories, and they're essentially just hydrating the tissues. And so that can help make it more comfortable throughout the time that you're not having sex, and potentially help with lubrication as well. Now, the next option is the most effective because it's actually curing the issue, and this is vaginal estrogen. Now, vaginal estrogen can come in multiple different forms. It can come in cream form, ring form, which is a ring you place inside that stays in there for 3 months, or a suppository. Now, both the suppository and the creams are used twice a week at night, and use them from the time you have symptoms till death do you part. And essentially just increasing the estrogen in the tissues so that you then can naturally lubricate like you were previously. And these are very, very safe. There's never been a reported breast cancer, ovarian cancer, or anything with vaginal preparations. And this is because these are local. And so they're really just working on those tissues, and very minimal amounts are getting absorbed into the body. And again, so these are generally very safe, very effective, and can be very transformative for this issue. So if you're struggling or your partner's struggling, I strongly encourage you to talk to them about it and maybe go with them to their doctor's appointment, or buy them some stuff from the store and bring it home and say, hey, I'd love to experiment with this with you, or I thought maybe you'd like this. And I think they'd really appreciate that.
Once again, you have some videos talking in depth about the lube, so please do check those out. All right, next question. My urine is looking pink. Am I bleeding?
Yeah, pink urine. So typically when you see pink urine, you are concerned about bleeding. And when you have blood in the urine, this is not something you should wait and see. You need to talk to your doctor about blood in the urine. And the reason is, while it is uncommon, it is possible that that bleeding could be coming from a cancer or a kidney stone or something that needs attention. And so we want to rule out those dangerous things like cancer. And so what does that mean? That means that you go through a couple procedures depending on how young you are and your other risk factors. Most people will undergo some sort of imaging of their kidneys. And so that would be either an ultrasound or a CT scan. You'll get a urinalysis and a urine culture, which are tests to see if there's red blood cells in the urine, and a culture to see if there's any infection. Very commonly, bleeding can happen when you have an infection, and that usually resolves after you treat the infection. And so if you find that you do have an infection, you should recheck your urine after you treat the infection to make sure that you still don't have bleeding in the bladder. The other thing would be to do a cystoscopy. Now, not everyone needs a cystoscopy. It depends, again, how many red blood cells you have in your urine and your other risk factors. But a cystoscopy is a procedure where you look in the bladder with a camera to look around and see if there's any tumors. Now, you might be wondering, well, hey, why can't I just get a CT scan or MRI or other imaging of my bladder to see if there's a tumor? Why do I have to have this procedure done? And the reason is the bladder is always changing, right? Because when you pee, it's deflated when it's full, sometimes not completely full. And so no imaging can really tell you if that's a fold or a tumor, right? It's not going to be sure if maybe your bladder just folded in on itself or maybe there's a mass there. And so it's really important to get this procedure done because it's the only real way to rule out bladder cancer. And unlike prostate cancer, bladder cancer is very aggressive and can grow relatively quickly. So time is important in this case. Now, I want to reassure you that getting a cancer because you have blood in the urine is relatively rare. It's about 15% of the time. Most commonly, we actually don't find a cause. Now, there can be many causes like kidney stones or stones anywhere in the urinary tract, but most commonly it's either due to prostate irritation in the man or vaginal dryness in the woman that's causing some microscopic bleeding. And so I want you to be reassured that oftentimes we don't find anything, but the important thing is that we're ruling out any sort of dangerous cancer or a stone that could become a problem down the line.
All right. Next question. My dad and his brother both have had kidney stones. Last week, had to take my uncle to the ER because he had to pass a kidney stone too. I am worried about this family history on my side because passing stones looks painful and I don't want that to happen to me. But can a female even get stones? Or is that just a male problem? I never heard of females having stones. Questions from Natasha.
All right, Natasha. So yes, females can get kidney stones. Men and women both get kidney stones. And so it's important that if you have a family history of kidney stones, that you should talk to your doctor and see a urologist. And the reason for this is we can do certain evaluations to see if there's problems that are causing you and your family to get kidney stones more readily? Like, are there metabolic issues with the way your kidneys process urine that's making it more likely for you to get kidney stones? So we can then target treatment options or prevention options in your case. But let me talk about things that you can do right now at home that can help you prevent kidney stones. And this is for anyone who has a history of kidney stones or is concerned about kidney stones, has a family history. This can apply for everyone. First and foremost is drinking 2 to 3 liters of fluid or water per day. Now, this is really important because this is going to help prevent any of the concentrations of lead or other things that cause kidney stones from building up, and it'll keep it very dilute. So that's the number one and most important thing that you can do. Next up is you can increase citrate in your diet. So citrate comes from fruits and vegetables, oftentimes things like very citrusy fruits. And so you can increase those in your diet, or if you like things like Crystal Light, that actually has a very high amount of citrate in it, and you can put that in your water and drink that. And one, it'll taste a little better, and two, you'll get more citrate. Another thing is you can limit your salt intake. So having high salt in your diet puts you at higher risk of getting kidney stones. Another thing is reducing the amount of oxalate in your diet. So oxalate, if you Google oxalate, you're going to see a bunch of different things, that foods that can have oxalate. But typically the high concentrations of oxalate come from very dark leafy greens like spinach or kale, and also things like rhubarb and even nuts. So you want to sort of make sure you're not eating those things every single day and try to limit them as much as possible. You want to decrease the amount of purines in your diet. So what does that mean? That means things that are very high in protein like red meats can also make you at higher risk for getting kidney stones. Generally speaking, limiting those in your diet as well. Now, the misconception by a lot of people is that if you have stones, you should decrease calcium. And in fact, you don't want to decrease it. You just want to have a normal amount in your diet. So you don't want to overdo the calcium, but you don't want to eliminate it completely either. You just want to make sure you have enough calcium. And so those are the things that you can do, but I do recommend in your case, if you have a strong family history, see a urologist, get what we call a 24-hour urine analysis to see if there's any abnormalities, metabolic abnormalities, as well as some blood tests to make sure there's nothing else going on that can be treated or prevented so that you don't suffer from a kidney stone, because kidney stones are exceedingly painful. I will tell you, every time I go down to the ER, I know who the kidney stone patient is because they're writhing on the bed in so much pain, and it's really miserable. Fortunately, we can help that, but it is not a fun experience to go through at all. If you want to check out the rest of this AMA, make sure to check out our membership at rinamalik.supercast.com so you, one, can see full-length episodes of the AMAs as well as Ask Me Anything, and get access to ad-free episodes and early releases of episodes with the transcripts on Supercast. And as always, remember to take care of yourself because you're worth it.